Welcome to the I Am You podcast. I am your host, Dr. Nitza Alvarez, a board-certified cardiologist and best-selling author. My hope with this podcast is to share stories so women can speak up and become the CEO of their own health. I am a cardiologist. I am a wife. I am a mother. My story is your story. I am you. Hello, everyone, and welcome to another episode of I Am You. Today, I am here with Miss Dale. Dale, welcome to the podcast.
Thank you.
Having you here is very unique because although we have sit down in this room with other women that are advocates for their health, in your case, you are a very strong advocate for your own health. And you are one of those women that will not take an answer for the last word and always listen to your body and want what is best for you, but at the same time, trusting the providers that are coming in your way, no? So I want the audience to know that the reason why we have you here is because you've been that woman that believe that there's many things that can be done for patients, that there's no one-size-fits-all therapy, and that we have to advocate for what we believe is true. So you want to start sharing with the audience, how is it that you and I started in this journey?
Sure. Happy to. So I guess it really started a long time ago. My dad was 57 years old, healthy, happy, died suddenly of a massive heart attack. I was 30 years old, and I just thought, whoa, this could happen to me. And so I started eating healthier, leading a very healthy lifestyle. And so always kind of looking, when I turned 57,
Scary time.
yes, I'm getting close to, or I'm at the same point where Daddy was, and I'm perfectly happy. I'm perfectly healthy.
Just like him.
Just like him. So once I've retired, I said, okay, now's the time. I should find a cardiologist. And my friend Sarah recommended you. And she told me that heart issues are different for women than for men. I didn't know that. So I said, okay, I'd better call Dr. Alvarez, set up the appointment. And I'm so glad I did, because after I had my first appointment, it was probably over a year later, I had an episode with my heart that I had never experienced before. But I already had a baseline established with you. So I had to stay overnight in the hospital. My heart started racing. It was going 124 beats per minute for an hour and a half. And that was scary, but I wasn't afraid because I knew I'd be fine. Something told me I'd be fine, but had to stay overnight in the hospital. I'll never forget India when she came in that morning. I was clearly the first patient she came to see. 8 a.m. that morning. She comes in. What happened? So, of course, I explained. But because you already had a baseline with me, you knew that I'm a healthy lifestyle enthusiast. You knew that I'm very careful about my diet. You knew that I exercised all the time. So she knew this was a dramatic event, and we resolved it. I started taking the flecainide medication, and I'm doing great.
So, this is a good point that you make right now. No, so you started with me. We did a very thorough baseline evaluation of your cardiac health. You were already postmenopausal, so we identified that there were risk factors for you and family history of coronary artery disease, which was always in your mind, particularly as you were approaching that age. But when you come into the hospital with your issue, one of the things that reassure you was, okay, I have a baseline. Number one, I have a baseline. So we have something to compare with. And number two, you have a provider that already know you. Yeah, so it's not just necessarily that now you're entering into a system, hospital system, that sometimes can be so scary and convoluted, where you go now with a cardiac problem, get in a system where you're going to be assigned to somebody that you didn't get to pick, somebody that you know nothing about it, and somebody that knows nothing about you. So if you can be proactive like you did, okay, you said, you emphasized a few times, I had a baseline. You have a baseline for me. So then it was easier to say, okay, we already had this. We don't have to evaluate this again. This is what we're seeing. This is how we're going to treat it. And rather than spending a week or a week and a half in the hospital and trying to figure it out, it was like, check, check, check. Let's try the treatment. Get out.
That's right. But the other thing that you just pointed out is I wouldn't have been able to choose a doctor. And what if that doctor was like my primary care physician, who basically scared me into taking a statin, and just said, no, take the medicines. Whereas I knew that you supported my feelings of not taking medicine as the only answer. I could change my lifestyle. I could change my diet. I mean, I already had a healthy diet, but a few minor changes, and I've had really good results.
The patient-physician relationship is something that not only need to be nurtured, but also it goes both ways. Now, we as physicians stand in a position where we have information and we can share our information with the patients and expertise, and we abide by guidelines and societies that we follow through. However, there's another way, which is the patient. No, the patient is their life, is their body, is their concern. So if we stand in a position where we just impose to our patients, then that's not a relationship. No, so we have what you're describing is somebody that you have in your corner that listens, that understands your concerns, and is willing to give it a try. Of course, I had to get some data first from you as your evaluation to realize it's appropriate. Yes, definitely. You do not have an absolute indication for statin. We can work this out with lifestyle changes. And if there ever a need to initiate therapy with drugs, does it necessarily have to be statins? And, it's important that we're carrying on this conversation because statins have been the most prescribed drug for cholesterol. And it's not necessarily it's not the only drug. It's not necessarily the best drug. It's not a drug that comes without side effects. And particularly for women, we are not good metabolizers of statins, and the studies were not done in us. So when you have somebody that want to impose that on you, knowing all these things without being willing to sit down and say, okay, is this the right choice for me? Can we talk about it? Sometimes it is, but not all the time. And in your case, that happened to be the case. It's like you work diligently. You were willing to work diligently because, as you emphasized earlier, you got to be willing to work. Like, if you don't want to take drugs, then you got to invest in health.
Right. I mean, and I had a history of heart problems from all sides of my family. All of my grandparents died of heart issues. My mother died of a heart issue. So I had it coming at me from all sides. And knowing that, boy, I'm really willing to do whatever I need to, but let's put the drugs at the bottom of the list. And I found changing my lifestyle a little bit, just really my diet. I cut out alcohol, I cut out dairy, and suddenly all the medications that I'm taking dropped down by 50%. It's great. So now I feel so much better because I found it, frankly, very upsetting being a healthy lifestyle enthusiast that I am. I mean, take a look at me. I mean, I exercise every day, at least once. I eat healthy foods. All my friends tease me because they don't even know what lentils are. So they have no idea. That's okay. But now I've cut back on the meds and I feel great. And this is more in line with who I am, if you know what I mean.
So for you, having a long list of medication was not an option. You didn't want to be there. And more important, you were willing to work to do anything that it was in your power to remove those medications from your list. Because, we get that request from our patients on a daily basis. Is there anything from my list that I can come off? No, and can I stop any of these medications? And I think, well, it's actually a very good question. No, it's always good to question what you're taking, and is there a real indication for them? Can we revisit my list? Because sometimes they keep adding, and nobody look at that list.
Right.
So that is actually important. But that doesn't come with a commitment. No, it's like, okay, can I remove something from my list? It's like, okay, so yeah, but you had to work on it. Right. Yeah. So what are we going to do to be able to come off the blood pressure medication, for example? The best treatment for blood pressure is lose your weight, exercise, cut down your salt intake. Yeah. And then we said, okay, can you do that? Let's start working on that, and then we will remove those medications. Yeah. Better is if you never end up in the medication if you do that before. Right. But I think that there's no more satisfaction for a patient, like you said, and as a provider, to see my patients committed and said, I am willing to do my part because I do not want to end up like my dad, or I don't want to end up like my mom, or I don't want to end up with a list this long with a bunch of medications that I had to take for this, for cholesterol, for blood pressure, for diabetes, for my neuropathy, for everything else.
Right. Now, and when you do make those changes, be patient. You don't stop eating dairy, or you don't stop drinking alcohol and the next day take a blood test and see. No, that's not the way it works. I don't know how long it takes. I'm not a doctor, but I think it was 3 to 6 months. And all of a sudden, you told me I could drop down my flecainide to once a day. The statin, I break the pill in half and I take it every other day. This is heaven. I didn't get rid of them totally, but I'm taking them a lot less and I feel better.
And you touched a very important point there. Be patient. No, it's human nature that we want immediate results. And we actually, the days that we live today where you can order something and it gets to your house the same day, or, you know, you just click a phone and then the food is in your doorstep. And then we want to see immediate changes. And it takes time. The body has to go through chemical reactions, cellular, tissue, for us to start seeing it at that level. And that is actually a simple blood test, like you say, but also we see it a lot in people as they're going through their start exercising, and they want to feel like perfectly fine after 3 days of going out to exercise, or go in the journey of weight loss. And then they don't see the changes after a few days of like modifying their diet. And we said, okay, it takes time. The same way that it took time for the body to be where it is today, then it will take time. But then you just had to trust. And that's really, I think that having you here is the best example. It's like, look at Dale, look at this. It's like, I did it. It's just that you have to be committed and be patient. You're going to be able to see those results.
Well, and you have to stick with it too. This is your heart. This is your body. You only get one. And you really need to take care of it. I mean, I think a lot of the women who listen to this podcast, they're all like me. They're grandmothers. They're mothers. I have everything to live for. Why wouldn't I stop drinking alcohol or stop eating dairy now? Because, wow, what a difference I've seen. Why wouldn't I want to be healthy? I want to see those little cutie pies grow up. Absolutely. I want to be a part of their lives. So you make a few changes and you stick with it and you're good.
You say it. It's like any other habit, no? Like you make it your commitment and you said, okay. And ultimately it's about what do you want to accomplish, no? And earlier in another podcast, I was mentioning the fact that if you don't invest on health today, if you don't invest time, if you don't put effort on it, eventually you're going to be investing that in illness.
Right.
So if you don't have 30 minutes to exercise today and you're not starting that now, then later on, you're going to be investing hours in a waiting room, an emergency room, a doctor's office, doctor after doctor, maybe an hour in the dialysis chair. So you got to see it like that. It's like an investment. I'm putting this effort here. I'm putting this money like any other investment. When it's money, you put the money here today so it can grow and then give you revenue later on. No,
That's exactly
so
right.
the investment that you put in now, you might not see it. Like you don't put $100 in an account and then expect to have $1 million 3 months later. The same for the body. You just say it very clearly. Invest on it, and then eventually you're gonna start seeing how will that pay off. Starting with knowledge. Now you started with, okay, I want to know how's my heart. Do I really need to take this medication? And then that empowers you to say, okay, I can do this, and I don't need to rely on so many drugs. But then you have to be willing to invest on it.
You have to invest on it, and you have to find a partner to do the investing with. So I work with you now on statin and all of that. My primary care physician, I'll work with with him on other things, but the heart stuff is strictly you, because you just, like that Boston Heart Panel test, you told me that you wouldn't recommend a statin to somebody with just the cholesterol numbers. You told me this isn't enough data to really make a recommendation. And there I am sitting there thinking, boy, I'm a jerk listening to this other doctor who's not even a cardiologist, but he wouldn't listen. He wouldn't listen when I said, I want to reduce, can't I reduce the statin? My cholesterol is below 200 now, or it was at 200. No, keep doing the same thing. And that was it. That's not a partnership. This is a partnership.
Beautiful. So you could not have said I could not have said any better than what you said. Okay. So partnerships matter. And this is actually the beauty of having you here today. So when you trust your provider, when they're listening to you, when they're receptive to what you have to say, sometimes we have to say, no, we're not going to go that journey, but we have to explain why. Yeah.
Yes.
And then, but that partnership is so valuable. And we have a lot of listeners that have not found that partner yet. They might be in the same situation that you were, where they are imposed a treatment and they're being told you must continue taking it without even understanding why they're doing what they're doing. Is there anything else that you want to tell our audience today?
I would think, I know that other women you've interviewed have talked about the partnership, but I would just emphasize, be patient, try different things. And yes, the medications are one of the things you try, but try living a healthy lifestyle. It pays off. I'm such an advocate for that. I wish there were some other way I could communicate it, but I just think it's so important. Even if it doesn't extend your life, it will enhance the quality of the years that you have. What could be better?
I love that. It's the quality of your life.
That's right.
If we live long and we stay young, it's great. If we feel strong and we're living long, it's great. But it's not about the quantity, it's the quality. And if you want to be able to enjoy those grandkids, amazing grandkids that God have give you, you want to be able to be there for them. You want to be able to play with them. You want to be able to pick them up. You want to be able to see them. And you have a motivation for it. So I love the fact that you use the be patient, and be willing to do it. It's worth it. And I hope that we have a little more Dales out there. I know that you say, I wish that I have another way of sharing this, but you already are. The people that are watching us in YouTube are seeing how amazing you look.
Oh,
the one that are not watching us and they're listening to this podcast in another platform, this woman look amazing, so check her out on YouTube. But the point here is that just you being you and eating your lentils, even when your friends don't know what lentils are,
Right.
and feeling so good, that is a motivation for others that are watching you and are seeing you in the day-to-day to be you, including your family, including those kids, including the one that said, I want to be like grandma.
And all
that
my
when
sisters.
she was this age, you know how beautiful it is that change the story, change the narrative. For you, your motivation to be healthy was the death of your dad because you didn't want to end there. For your grandkids, the motivation to be healthy is the health of the grandmother and how good does she look as she was getting older. Yes, so that is amazing. There's a great legacy that you're leaving for your family and the community and the people that are listening to you today.
I sure hope so. Thank you.
I thank you for being here today, Dale. And this takes us to an end of another episode of I Am You. Thank you for joining us. I hope this episode has empowered you to be the CEO of your own health. Tune into our next episode and don't forget to follow us on Instagram and Facebook at NITZAMD. To explore more on this and related topics, visit our website, NITZAMD.com. If this episode resonated with you, please like and subscribe. And one more thing, share with the wonderful woman in your life.